Hey everybody, Mr. Regan here, and today we're going to be looking at how we're going to be completing our proposal outline today, where we're going to look to find the strongest evidence for our next set of tasks and how we're going to be using this evidence to meet the requirements on our rubric for the final proposal. So let's go ahead and get into it. We are now completely done with our first two phases of our internship, and we are going to be starting phase three today, the proposal phase. The proposal is a write up that we have that basically explains which of our treatments is the optimal design and why. The proposal today we will be starting will focus on creating an outline for our final proposal. So we'll be breaking down how to complete those outlines here, and what you'll see on the next set of tasks, along with the rubric, we'll be using to grade your final proposal. So in the next set of tasks, you're going to see a table called the proposal outline with our three criteria. Each of the criteria and proposal outlines will have three parts. Part one will have the final results and your design goal. Part two will have a comparison to another treatment design. And part three will have your background research and your true evidence. You're going to be completing one of these tables, one of these outlines for each of our three criteria to help you collect the best evidence to support your optimal treatment design. So let's talk about what you're going to be putting in each of those different sections of your table. For your final results, this is going to be your test results for your optimal design. So, for example, if we're looking at patient side effects, this would be the side effects that you have for your optimal design. For your design goal, this is the value determined as the best possible for that specific criteria. So, for example, if you feel that mild or none was your design goal for that criteria, then you'd put that in the section. Comparison to another design, this is where you use examples from other iterative tests or other examples from other isolated tests, and you talk about the differences in design. So, for example, a different design with mild side effects but it resulted in 65% resistance for drug A. So notice we're talking here about how even though mild was our goal, it would result in high resistance levels for drug A, and that's why we have our moderate as our final result. Now, the last part is going to be your background research. This is where you are going to be putting in your evidence that you got either from your reading in your dossier, from your isolated tests, or from your iterative tests. So what can this evidence be? Well, this is where you ask yourself, what does the dossier tell you about patient side effects for each drug? And what did you learn about patient side effects using your malaria med? So, for example, if you're looking at using some iterative tests as your evidence, you'd ask yourself, well, what did you learn about patient side effects? What did you learn about the dose size? What did you learn about the treatment days? What did you learn about the combination of drugs as it relates to side effects? And you're going to complete one of those tables with this sort of information for each of your three criteria. So if we're going to continue with that example, patient side effects, notice for our final results, this would be from our optimal test, moderate. Our design goal, what we were trying to get, mild or none. Your comparison to another design, well, another design with mild side effects, but a high percentage of resistance. So 65% from drug A. And from here, you would pull in data from your actual testing that you did to help you explain and help you support this idea. So, for example, we could look here and we can talk about how moderate maybe was your overall goal. You could talk about how you ended up with 54% drug resistance for A instead of 65. And you can talk about how this relates to your dose size. So you can talk about your dose sizes with your smalls and large, talk about your treatment days, 5. You can talk about your drug combinations, A and C. All this to help you support this idea of why your treatment is the best and why this is what's best for patient side effects. Another piece of evidence you can use, whether it's an iterative or isolated test, is data from your dossier. So this can be direct text evidence from your dossier that you use to help support your idea as to which treatment combination is best. So again, you'd fill it out as normal, telling us what your final results, design goal, and what your comparison to other design was. And then here you would pull in some text evidence. So for example, we're thinking about your design choice and how it affects patient side effects. We're looking at this idea that some drugs work well, but some with severe side effects make patients feel bad. These side effects make patients less likely to follow the malaria treatment correctly. So, for here, we would be connecting this idea of having bad side effects and how people wouldn't take their drugs to how your optimal design, whether it's the dosage size, number of days, or drug combinations, leads to a better patient side effect. And you'd fill this out for each of our three criteria. So you do this for side effects, you do this for drug resistance, and you do this for cost. Each one of these parts of your proposal will obviously be written from your outline. And when you create your final proposal, you'll have this rubric that we will be using to grade your final overall proposal. Your outline should hopefully focus on the following in the meats section here in the middle. Uses two pieces of strong evidence to support the following ideas for the completion of the criteria in your design. So, what we're looking for is an explanation within your final proposal using your two pieces of strong evidence that explain why the features of your treatment were selected over others. So, in other words, why you selected the days, why you selected the doses, why you selected the combination of drugs, and then how the features of your design accomplish the criteria in an optimal way. So, this is where you explain why you got a moderate side effect instead of mild or none. This is where you explain whether you accomplished your goal of getting a certain resistance level or whether or not you were able to bring the cost down as you wanted. So, as you're creating your outline, some things to keep in mind. Number one, find evidence that directly relates to your criteria. So, as you complete the outline table for cost, only focus on evidence that relates to cost. You do not need to include everything you learn, but you should focus on the strongest evidence. So if you have a couple pieces of iterative tests, or if you have a couple text evidence from the dossier, make sure you use the strongest one. And last but not least, the best evidence will come from multiple sources. So try to find evidence from your dossier and your My Malaria data sheet. All right, folks. So ask yourself, do you know how to find the strongest evidence for your next set of tasks? And do you understand how you need to use your evidence to meet the requirements on the rubric? If you feel confident, go ahead and put your X in the survey and begin the next part. If you'd like to see that slideshow, you can click on the help button. Otherwise, good luck.